Hello, beautiful endo warrior goddesses. I hope that you're having an awesome day, and I thank you so much for tuning in to today's video. I'm loving starting off these little vlogs, traveling with you, and if you haven't seen my acupuncture video yet, this video is going to be almost an identical setup. Same day, same situation, just filming a little bit differently for each of these appointments. So I wanted to take you along with me because today is a day of self-care and self-healing and all about, prioritizing my health, which is my whole entire mission in life. I recently discovered that my cosmic mission and cosmic goal in life on this earth plane is embodiment. And that makes so much sense to me, just given some of the physical and mental, spiritual, and emotional challenges that have popped up for me in my lifetime. And even some of my family in the lineage. We've had a few individuals who've had health issues related to their body. I lost my grandma when she was 55 years old, or I think she might have been 56 years old, to MS, which is multiple sclerosis, and it is a disease that takes over your body. And so I feel like my goal and my legacy, and that makes sense for me, is embodiment on this planet and being able to fully embrace, living my life to its fullest with the body that I was given. And whatever that looks like, whatever obstacles that pop up for me. So, dealing with endometriosis and sharing my story and my journey with you is more than my purpose. And that's why I'm so grateful that we have crossed paths, because we have crossed paths in the name of divinity and in the name of synchronicity. So I thank you for being here. If you're new to my channel and we have synchronistically crossed paths just now because of this video, welcome, welcome, welcome. My name is Bailey M. Bain. I'm a spiritual entrepreneur as well as a yoga and meditation instructor. And like I mentioned, I'm a fellow endo warrior goddess myself. I have been dealing with endometriosis since I started my period at 13 years old, and 11 years later, now at 24 years old, this past April, a couple of months ago, I was officially diagnosed with endometriosis by laparoscopy. I had my surgery in April, and now I'm working on alternative treatment because I know that my body does not respond well to birth control. So birth control and hormonal birth control is not necessarily an option for me. So pain management in alternative and holistic forms has been my major goal and my major concern throughout this entire experience, and I'm super excited to share that with you. Before I even go any further, as I mentioned, I wanted to treat endometriosis holistically, and I wanted to just give a huge shout out to Jessica Gonyo. Jessica Gonyo has been a huge inspiration and advocate for me as she's been working with me to coach me through some of these holistic and alternative options. Jessica is a women's wellness coach, and she is specializing in helping women step into their divine purpose, their divine individuality, and focusing on women's health in a way that addresses the needs of the individual, which I think is so important. And that's what I love about the work that Jessica is doing, is because not everybody's going to work with her in the same way, in the same capacity. She meets you to your needs, and that is what I think is so incredible. So Jessica, if you're watching this, thank you so much for the work that we've done together so far. I'm eternally grateful for the support that you've given me, the recommendations, and the accountability to take action and find a plan that I can actually accommodate and stick with. So that feels really, really great. Please check out Jessica's information in the link in my description. I hope that she can help you in the same capacity that she has supported me. So, one of the recommendations that Jessica has given me for endometriosis, specifically to address and deal with pelvic pain, is pelvic floor physical therapy. And before we spoke, I had honestly never even heard of pelvic floor physical therapy at all. I had heard of physical therapy before, but not pelvic floor physical therapy. And so she made that amazing recommendation to me, and doing a little bit more research about it, I learned that it is actually something that a lot of individuals with endometriosis use as a treatment option because it does address pelvic floor pain, and it addresses utilizing the muscles of the pelvic floor properly in everything that you do, from just exercising to going to the bathroom to sex, and even if you're doing a Kegel properly. So I am very excited to see if this offers any support. I was also reading that pelvic floor physical therapy can be very helpful for anybody experiencing or who has gone through abdominal surgery, and that is what I have just gone through with this laparoscopy. So if nothing else, I'm just hoping and kind of thinking that the physical therapy just might help me gain back some of the muscle strength in the pelvic floor after my surgery. So we will see how this, and then I'm going to come back on later and tell you exactly what they did, because I'm not even entirely sure what to expect, but I'm going to tell you all about our appointment so that you know what to expect if you decide to try a pelvic floor physical therapy for your endometriosis as well. So I will check back in a little bit. Okay, I definitely did not get to come on and finish this video yesterday, so it's the day after, but I still wanted to come on and tell you about my experience with pelvic floor physical therapy. I had my first appointment yesterday, and it went very well. I'm actually really excited to continue this as a therapy option, because I think that it's actually going to be very beneficial for me and my experience moving forward. So I know you're thinking, like, what on earth should I expect? And that's a very good question, because I had no idea either. I've heard various things, like, just I really had no idea what to expect going into it. If is it something that, like, you undress for? Do you stay clothed? Like, what happens? I really had no idea what to expect for the first session, so I went into it with just a super open mind. I even felt a little nervous. I have this, like, recurring thing where it's like I don't necessarily always feel comfortable when men are my, like, healthcare providers, and I've talked about this before with my OBGYN, and he's a man, the guy who did my surgery. My doctor is a man. He did my surgery, and I just think so highly of him. I'm so grateful that we crossed paths, and I know that that was for a reason, and I talk about that in other videos, so check that out if you are interested. But pelvic floor physical therapy, I was like, do I really want to work with a male therapist? And I got a female therapist, so thank goodness on that front. That made me a little more easy into things. So we started our session, and she just did, like, so we just did a general intake. You go over your health, what kinds of issues you've been going through, where your pain is, what kinds of things you are struggling with when you're experiencing pain in that area. And I am 2 months post-op, so she just kind of, like, did some general motions to figure out, like, my arms. I don't even think we tested my arms. We did my leg strength. She just did some general, like, exercise motions to test my leg strength and my pelvic floor strength. And then we looked at my incisions, and she wanted to just, like, check and make sure there was no scar tissue around the incisions. And she showed me how to do, like, a fascia massage around the incision sites. And I will actually share that with you in the Endo Warrior Goddess community. So again, check that out in the description below, and I will talk about it again at the end of this video. But I'll show you more detailed inside of the community if you feel so called to check that out. She also did, like, a fascia massage on my abdomen and my lower back. So she just kind of, like, placed her hands around those two areas and just, like, moved the fascia tissue around. So that's tissue underneath It's under the skin, obviously, but I believe it covers the muscles, and it actually attaches everything in the body together. So that tissue she was working on massaging in my abdomen and in my back. And then she kind of went down along, let me see if I can show you, kind of like through here where your legs and hips meet, those like that hip flexor area. She did like a pressure point kind of pressure point release therapy there. So she kind of was just pressing her hands on those spots, and you could feel how tight the muscles and ligaments and everything were in there. Like, it was uncomfortable, which is, you know, not abnormal for physical therapy, but it's things that you don't think about, like why those little muscles and ligaments are so tight. But it's something that happens and something to work through and work on. So that's why I'm doing this. And it's things that I didn't even think of. So I'm really glad that we got to work together. And then we went through, I'm sure you're all familiar with Kegels. That's that pelvic floor exercise. We kind of went through some of those in a laying down position with the knees bent. And what she did to kind of assist through that and just kind of see where I was at with like strength and pelvic floor strength is she just kind of like took her hand and put it like, she pressed her fingers like around my tailbone while I did the motions. I know it sounds really weird, but she was able to kind of give me some pointers on where I was at with my pelvic floor strength and weakness, and what I needed to work on. And she gave me some exercises to work on there. And then, you know, we kind of met together for, I think, like 45 minutes, and we worked through all of that. She gave me some exercises to do on my own, and I'll share my specific like exercise regimen that she gave me inside of the Endo Warrior Goddess community, but we're already getting pretty long on this video. But I wanted to come on and just share my experience with pelvic floor physical therapy, because I know that it is something that a lot of people are curious. Like, it's something that often has a copay, even with insurance, so people want to make sure that they're not wasting their money on something that isn't really going to provide them much relief. So that's what you're wondering, is relief. Now, yesterday I didn't come back on. I was actually super exhausted and experiencing some weird symptoms from the acupuncture. Not really weird symptoms, but just I had a really big energetic and emotional release. So I was dealing with some things there, and I talk about that in the acupuncture video. So check that out if you get a chance and feel so called. But I was also just very, very, very tired and very drained. So I knew that I worked a lot. I worked with my body a lot yesterday, between the acupuncture and the physical therapy and just doing my normal, you know, yoga practice and daily yoga practices. So I ended up going to sleep last night, and I slept so good. It was crazy. But today I actually got my cycle, and I can tell you that the pain isn't really as bad as it normally is. And I can honestly, it could be a combination of both of those things, but I am excited to continue both of those things and see how they continue to improve my symptoms. Now, I don't feel perfect. I don't feel totally pain-free. I still have some cramps, but it's definitely, you know, knock on wood, I did this last video too. It's definitely a little bit more manageable this time, which is great. So pelvic floor physical therapy, she scheduled me for 4 more sessions once a week, and I will continue to update you. Maybe not on here. I might just update inside of the Endo Warrior Goddess community. So please, please, please check that out. The information is in the description below. This is our safe space to just build community and share more personal resources for endometriosis healing. And it goes beyond just we go beyond just the physical side of healing. We are really interested in the emotional, spiritual, and mental health side of endometriosis as well. There's a lot that goes into womb healing than just physical healing. So I'm very much looking forward to continuing to share resources inside of that community and build community with all of you, because that's what this is all about. So don't forget to check out the Endo Warrior Goddess community in the description below, and I will hopefully see you inside. If you enjoyed this week's video, please don't forget to share and give this video a thumbs up to help other Endo Warrior Goddesses find this content. I hope that you're all having a fantastic day, and if you have experiences with pelvic floor physical therapy, I would love to hear them in the comments below. It always warms my heart to get to know you and engage with you in the comments below. So I will see you next time. I am rambling at this point. I hope you have an awesome day. Bye. Thanks for watching. Don't forget to subscribe for more videos. Join our Endo Warrior Goddess community by clicking the link in the description. And as always, I'll be back every Tuesday, Friday, and Sunday with more content.